It manages to sneak up on us every year. Before we know it, flu season will be upon us again. According to the National Institutes of Health, the influenza virus, otherwise known as the flu, affects up to 20% of people living in the United States every year. With that in mind, what can you do to make sure you're fully prepared this flu season? First, make sure you're all caught up on your annual vaccinations, then come back and watch this video on how to deal with influenza. Also, be sure to subscribe to Bestie and ring the notification bell to stay up to date on all our daily videos and content. While the flu can make you sick, we promise that you'll never get sick of us. When making preparations for flu season, one of the first things you should do is make sure you know how to recognize the telltale warning signs of the influenza virus. The flu shares many of its most common symptoms with the common cold, and as a result, it can be fairly easy to mistake one for the other. As a general rule of thumb, however, symptoms of the flu usually happen quicker than they do for a cold, and are usually much more severe as well. According to Healthline, early symptoms and warning signs of the flu include any of the following: a runny nose, coughing, fatigue, sudden fever, a scratchy or sore throat, chills, muscle or body aches. If you or anyone you know starts experiencing these symptoms around flu season, it's probably the first sign that you should get yourself or them checked out. Another thing to consider is that while a sudden fever is commonly one of the early symptoms of the flu, not everyone who contracts the flu will experience a fever. So now you know how to identify the most common calling cards of the influenza virus. However, that still doesn't give you much information on what to do once you start experiencing these symptoms. If you suspect that you're starting to come down with a case of the flu, you should begin to carry out the following steps in order to give yourself the fastest possible recovery, as well as to minimize the chance of accidentally spreading the virus to others. Wash your hands frequently. We cannot stress this one enough, people. Washing your hands is one of the most effective ways that you can minimize and prevent the spread of the influenza virus. Healthline recommends that the most efficient way to wash your hands to prevent the spread of germs is to scrub with soap and water for at least 20 seconds before rinsing. Don't cough or sneeze into your hands. Seriously, you'd be surprised as to how many people overlook this seemingly obvious piece of personal hygiene. If you sneeze or cough into your hand, all that's going to accomplish is guarantee that your flu virus and other germs will be spread to whatever surface you touch with that hand. It's gross and unhygienic. Instead, it's recommended that you direct your coughs and sneezes into the crook of your arm, by which we mean the inside part of your elbow, or into a disposable tissue. If you do slip up and sneeze into your hands, make sure to wash them as soon as possible. It's not rocket science. Stay hydrated. Drinking lots of fluids, especially water, tea, and drinks that are high in electrolytes, will help push you towards a speedier recovery. Drinks to avoid are anything that contains alcohol, caffeine, or an overabundance of sugar. Eat healthy. By making sure your body is getting all the essential nutrients it requires, you can make sure your immune system is firing on all cylinders to help you get rid of the flu faster. This can be a difficult one in practice, as having the flu tends to diminish your appetite, but small meals that incorporate lots of fruits and veggies will help you make a faster recovery. Call in sick. Remember how we said you should avoid spreading the influenza virus to other people? One of the most guaranteed ways to avoid infecting others with the flu is to stay away from them. If you have a contagious illness, your employer should be understanding when you say you can't make it in for work that day. No sense in putting others at risk of infection just for the sake of keeping a perfect attendance record at the office. Stock up on the essentials. A few useful things to have in your anti-influenza toolkit include tissues, decongestants, over-the-top pain relievers, and cough suppressants, as well as plenty of fluids and healthy foods like we mentioned earlier. If you're not feeling up for a trip to the pharmacy though, you might want to ask a friend or a loved one to make a pickup for you instead. Which brings us to our final point. Stay home. We get it, you think you're tough as nails. A couple of lozenges and suddenly you feel like you're ready to take on the world again. Well, sorry to tell you this, but things don't really work that way. The best way to kick the influenza virus is to stay home and get plenty of rest. Now that you have a comprehensive list of all the things you should do when you have the flu, what about the things that you shouldn't do? Some of these things might be a little bit on the obvious side, but when it comes to your health, these things always bear repeating. If you're coming down with the flu, here are some things you should try not to do. Don't go to work or school. Again, not only should you stay home and rest, but showing up to work or school will only make you more likely to spread your contagious illness to others. In fact, you'll most likely have already entered the contagious phase of the virus a day or two before you even start to show symptoms. To minimize the risk of spreading your germs, just stay home. Avoid physical contact. Try to avoid handshakes or hugs until you're sure you've made a full recovery. Physical contact will only give the virus even more ways to spread to potential new victims. So please reduce the risk to both yourself and others, and keep your hands off. This one should also be fairly obvious, but avoid sharing food or drinks with other people during the flu season as well. Or just like in general, Joey doesn't share food. Avoid certain foods. Processed foods and foods that are high in sugar don't offer up all that much nutritional value and won't be able to contribute much to your immune system. It's best to stick to healthier foods instead. Don't skip meals. Like we said before, being sick will probably take away most of your appetite, but your body still requires nutrition in order to fight off the virus. You can eat smaller meals than normal, but don't skip out altogether. Avoid crowds. If we sound like a broken record, it's only because we can't stress this enough. Being in crowded places will only make your virus that much easier to spread to others. If you don't already have the flu, avoid crowds in the flu season to make sure nobody there spreads it to you either. Be cautious with unproven herbal remedies. According to Healthline, herbal remedies and supplements are not scrutinized by the FDA for things such as quality, packaging, and safety. If you want to try one of these remedies, make sure you're getting it from a reputable source or ask a medical professional for a recommendation. Don't smoke. Since the flu affects your respiratory system, smoking will only serve to irritate your lungs and make your symptoms worse. I mean, there are plenty of other reasons why you shouldn't smoke, but you probably already know most of them, right? Don't push yourself. Seriously, just stay home and get some rest. Influenza is a progressive virus, which means that the symptoms you experience will most likely get worse before they get better. The more you try to fight your symptoms, the worse they'll get, so take it easy for a couple of days. The only exception to staying at home and resting should be if you are either considered high risk for influenza-related complications, or if you are experiencing symptoms that are more severe than the ones previously mentioned. People at a higher risk for flu-related complications include people over the age of 65, children under the age of 2, people with chronic medical conditions such as asthma, diabetes, or heart disease, people with compromised immune systems, pregnant women or women up to 2 weeks postpartum, and residents of nursing homes. For severe symptoms and warning signs of an emergency, be on the lookout for difficulty breathing, shortness of breath, chest pain, confusion, persistent vomiting, or sudden dizziness. For infants and children, severe flu symptoms may include bluish skin, irritability, a fever that accompanies a rash, trouble breathing, an inability to eat or drink, or crying without tears. Additionally, if your flu symptoms don't get better after 2 weeks, or if you start to recover and then suddenly feel worse, this means that a complication may have occurred. In this case, you should go see a doctor right away. Hopefully, this list will leave you feeling a little more prepared for the next time flu season rolls around. Did you find this information useful? Do you have any other tips or suggestions that you think are worth sharing? If so, feel free to drop a comment in the comment section below and keep the conversation going. Also, make sure to start sharing this video again whenever flu season starts. You never know who might need to see this. Enjoyed this video? Hit the like button and share with your friends. Also, subscribe to our channel for more videos like this. Thanks for watching.